So I'm very unamused because now the incision in my front is leaking spinal fluid and the incision in my back is leaking spinal fluid. That's happening. I don't quite know what to do with this information. Welcome to the week, by the way. I don't think I said that yet. The deal is, I got up to go to the bathroom and I have been surprised all day at how well my incision on my belly was treating me. It wasn't really leaking very much, so that was giving me a lot of hope. And then I got up to go to the bathroom and I felt something like dripping down my back, and so I put my hand on my back and it was spinal fluid with some blood just kind of pouring out of my back and soaking my hand. So I was like, okay, that's not good. And we called the nurse, and the nurse decided we'd just put a dressing on it and check on it every so often. Then I go to sit back and we realized that my entire pillow, blanket, sheet, everything was just absolutely soaked, drenched in spinal fluid. So they called neurosurgery. Neurosurgery came and checked my dressing, ordered me to stay totally flat until tomorrow, when hopefully they can come up with a plan. I don't know if that means surgery tomorrow or the day after, since my doctor is just getting back and has clinic tomorrow. But until then, I am NPO again, and we're struggling a little bit with that because my blood sugar is dropping pretty low and I need some kind of dextrose to bring it up. We're waiting on them to put the order for the dextrose, the sugar, into the system, and it's just not happening. So we'll see how that goes. I mean, they're not even going to take me in for surgery if my blood sugar is this low. Okay guys, the time has come. I am being taken down to the operating room to figure out what's going on with my shunt. It looks like basically my body is just, for whatever reason, not reabsorbing the fluid that is being drained out of my back. So the best solution to that problem is to drain it somewhere else, and the best place to drain it is directly into the heart. So basically I'll be going in, they'll open up my belly, they'll take out the shunt, make sure that the shunt is working properly. If it's broken, they'll fix it, and it would be great if that was the problem, but I don't think it is. And then they will decide what to do from there. They will probably decide to route it down into my femoral artery, up through that, and all the way up into my heart. So get excited. My question is, could this possibly help my POTS and blood volume issues? We will see. Okay guys, so I'm back from surgery. Surgery did not go anywhere near as planned. When he opened me up, he found fluid that may have been indicative of an infection. So unfortunately, that meant that he had to take out all of my shunt hardware completely, and I am now having my shunt externalized, meaning that instead of my brain and spinal fluid draining into my abdomen, it's now draining into this bag over here, which is both really gross and really cool at the same time. So anywhere I go, my external brain over there also has to go. Not that I'm really going anywhere. Hold on, let me see if I can show you what the little tubing looks like. This is kind of what we're dealing with right now. Sorry, I'm trying to keep my modesty a little bit here, but this tube is draining through here, which goes all the way down and connects down to the bag over there. And every hour they're coming in and draining more fluid out. So that's great. Hopefully in the next couple days we'll find out if it really is an infection, and if it is an infection, what kind of infection. It could be that I only need a few days of IV antibiotics, and it could mean that I need 6 weeks of IV antibiotics, if not more, which would really stink, because not only would I have to go home on IV antibiotics, but I would also have to go home with no shunt. And
all over again.
we don't want to go there yet. Hold on, I want to hook up to the oxygen. Okay, that's a little bit better. I was getting kind of lightheaded from talking. Anyway, not what any of us expected, not what any of us wanted to hear, but I am in the safest, best place. I'm in the best hands I could be in. And I have the best nurses. The nurse who stayed with me last night when my mom went to Subway and was there when my back started leaking, she came down today. She usually doesn't work on this floor. And she came down and she brought the sweetest gift basket, which was just so nice. She brought little snacks for my mom and some hair products that my mom had forgotten at home. She had like a little headband and some other cute little things for me. And I cannot even tell you how much it meant to me. Oh my goodness. It's hard because, you know, just I want to get back home. But gosh, am I thankful for medical science. I got a machine working as my spine. We're just crossing our fingers that the weird pus-looking fluid is not really a serious infection. In that case, I could go into surgery on Wednesday. We just have to wait. It's a waiting game now. They took cultures and now they have to wait and see if I grow anything funky, and hopefully I don't. I'm feeling a lot better than I was. Not feeling good, but they gave me some morphine and the pain is like so much better. I was not in good shape when I woke up, and likely won't be in great shape once that morphine wears off. And if you guys are wondering if I had any qualms about taking the morphine after my last morphine experience and having a hard time getting off of it, the answer is no. I think that we learned a lot from my experience last time, and that I will be using it sparingly and not long term. We will be watching it closely, and at this point the best thing for me is to have pain relief. So no, I'm not against the morphine.
For a couple days.
Yeah, for a couple days. I don't want to take it for 2 weeks like I did last time. That was my mistake. Although really it wasn't my mistake, it was the doctor's mistake. Or miscommunication rather.
Lack of communication.
There wasn't any communication. Yeah, so I'm not against pain medication. I'm very stubborn. I will go out of my way not to take it, but today it was worth it. And maybe tomorrow it'll be worth it too. I don't know. I play one step at a time. So I'm gonna bid you guys good night. This should be interesting. Thank you so much for the outpouring of prayers and love and support. I mean, you have no idea what it means to me. So you guys rock. And the visits. We did have some visits from friends, which was really, really sweet and always treasured. Hello you guys, it is Tuesday. I am just checking in. I have just been crocheting and waiting and sleeping today, and I definitely really needed this rest day. Still a little bit hard to rest when someone has to come in every 15 minutes to jiggle around your spinal drain, but I ended up getting a pretty good amount of sleep today, so that's made a really big difference. And my feeds are going, you know, I just feel like a day of recovery was in order. But I also Amazon Primed a bunch of stuff to the room so that I would have projects to work on. I brought my crochet stuff, but I didn't have any of the embroidery stuff, so I do now. Turns out you can just Amazon Prime stuff to your hospital room and it's amazing. As for how I'm feeling, it's kind of hard because I'm not really allowed to move or sit up with the drain going, and if I want to use the bathroom, we have to clamp it off and wheel it with me. So not super portable, and there's not a lot I can really do, but maybe that's God's way of just saying to relax. But the worst part about that is actually one of my best friends ended up having to come today, and she's literally on the other side of that wall. Like, we were knocking back and forth on the wall. That's how close she is. And neither of us are able to get up. At least the moms have each other. Yeah, so I mean, right now we're just literally waiting for funky stuff to grow on a petri dish. It kind of makes me a little bit nervous because I'm not being medicated for anything yet, as we don't know what it is. But if it's growing on a petri dish, I feel like it's growing in me, and I would like to know what it is so I can start treating it. But I did get this amazing new t-shirt. It says "Rise Up and Be Strong." I definitely didn't pack enough clothes to be here for a while, and I had it with my gown. Basically, people just always are coming in and looking at my abdomen, and I have like lines in, and so it's not super ideal to have to hike everything up. So my friend Matthew kind of masterminded a plan with my mom to get me a nice little t-shirt, and I also had leaked spinal fluid all over the shorts that I had, so my mom literally just bought me like a bunch of boxers from the little boys section, and I stinking love them. I don't know why guys have way more comfortable underwear than we do. These things are pretty amazing. I feel like females need to get on that boxer train. Hey guys, it's Wednesday. We just got the bad news that my infection is in fact an infection. It's a staph infection. Luckily we caught it early. It's very surface, but it is an infection, and it's on my shunt, and therefore the rest of the shunt has to come out of my body, and I will have to undergo treatment for the infection before the shunt can be placed back in. So they are taking me down for surgery now to take the rest of the tubing out of me, which means I will no longer have the external drain. I will no longer have any sort of drain, and I will be right back at the beginning with my pressure. That makes me nervous. I have never gone into a surgery knowing that I will be waking up feeling worse than I went in, and we don't have an exact plan for how we're going to treat this infection, which would make me feel a little bit more at ease losing the shunt and then having a plan already in place. But I guess we'll meet with infectious disease afterwards, and they will put together a plan, likely IV antibiotics. We're probably looking at a couple weeks, and I really don't know. He said it's kind of just bad luck. Maybe 1 or 2 in 100 has this problem. I am thinking that the leak is the reason for the infection and not vice versa. We'll never know for sure, I suppose. Good news and bad news. Good news, we caught it soon. Like, if we hadn't caught it early, it could have spread to my spinal hardware. There are some abnormalities already in my CSF, my spinal fluid. So it looks like the infection has already made its way there, but not terribly. I don't really have a fever. I don't feel super infected. Ugh, it's a lot to take in. It's not the news we wanted. And now we're stuck kind of like, I don't really want to go home all the way because I don't want to be that far away. I don't want to have to deal with the drive. But then of course we have family at home. So we're just going to have to take it one step at a time. And right now that step is to just get the rest of this shunt out of me. Pray that the next step makes itself clear and that we can make the decisions that are best for me and best for our family as a whole. So onward we go, back to the operating room. Yay. Hello you guys. So I had surgery. They took out the last remaining pieces of my shunt. Apparently that is basically what the staph had grown on. Luckily it looked like it really hadn't spread very much to my body. It was mostly just on the shunt. And so by taking out all of the tubing and all of the pieces, they were essentially eradicating the infection. That being said, we spoke with infectious disease and they are putting me on IV antibiotics for at least 2 weeks, maybe 3. I just hung my first dose, and as you may be able to tell, I think that I'm either allergic to it or I'm just having a mast cell reaction. So they're gonna give me some ice, maybe some Benadryl. I hope I'm not allergic to it, and I hope this isn't gonna continue because I am supposed to be doing it 3 times a day. And I don't feel very well. Okay, so now I'm just gonna, I guess, be in ice packs for the next 2 weeks. I don't know. I don't really know what's gonna happen. Maybe I'm totally fine and I'll get used to it, or maybe it'll get worse with every dose. That's something that we're gonna have to watch out for. But luckily, so far, it seems like it's kind of the only symptom. So if this is it, it's not so bad. And I think I can make it through that. I just don't want it playing around with my mast cells and making any of that worse. So we'll see. I have to say I'm not too excited about having no shunt. It was the first surgery that I've ever had that I woke up with worse symptoms than I went in with. I'm kind of back to square one on my pressure symptoms. So like a really, really bad pressure headache, vision issues, ear ringing, nausea. I don't know about balance because I'm still not allowed to get up. I have to lie flat. It's gonna be a lot and it kind of stinks. I was really hoping that I wasn't going to need to have surgery. I was really hoping it was a false negative. But I think as far as infections go, if you're gonna get one, this is kind of a fairly mild, common, easy one, if any of them are easy. It's not looking like it's going to be anything really, really dangerous, just something that's going to take some time. I'm a little surprised how much pain I'm in. I think I'm just so tired of being opened up in the same incisions over and over again, especially since my spine is already so sensitive, having had so many surgeries there. I don't know, it hurts to lie on, and it's a little bit more tricky than having the belly incision because I really can't ice it. The ice was like my saving grace for my belly, and you can't really comfortably lay on one of these ice packs. Or my friend just got out of surgery. I saw her mom tonight. The doctors have promised me up and down that I am not contagious. I've asked every doctor. I've asked the infectious disease people, and they said as long as they don't have like an open wound that is literally like coming in contact with my open wound, they're really not in any danger. But that's also something that's going to be up to their discretion if they want to take that chance or not. You might have to learn Morse code. We found that we can bang on the wall. Anyway, I'm gonna bid you guys good night. It has been a long day. It's been a long lifetime. But hey, I'm not complaining about that one. Also, I found a good way to pass my time as I'm not allowed to get up, and that is organizing my new embroidery floss into my new organization box. Very, very exciting. I can't wait to color code them all. Are you seriously laughing at me? Jeez, everyone's a critic. you guys, it's Thursday today. The last 2 or 3 doses that I've had of the antibiotic didn't really cause that same reaction as the first one. I think maybe my body was just in one of those mast cell moods where it just wasn't having it. I feel a bit more stable now and it's going a little bit better. The only thing is now I'm dealing with not having the shunt anymore, which stinks. Now I just have a lot of pain from where the shunt was. But anyway, today is a really special day because today is Mom's birthday.
Am I on camera?
Yeah, you're on camera. You want to say hi?
Hi.
Happy birthday.
Thank you. I'm 29.
I'm so sorry you're spending it in the hospital.
But there are perks. Look, I just came back to the room to this.
Okay.
Peanut butter cookie with chocolate on top. Not 1 but 2 gigantic chocolate chip cookies.
Oh my gosh, those are huge.
My favorite double chocolate chunk brownie and a sugar cookie.
Oh my goodness.
So
we had
they
the
covered all the
best
bases. Oh, wait a minute.
nurses.
And of course Hershey Special Dark with
Oh.
almonds.
I want to show them what I got you.
Yep.
Well, it fits the theme quite well, does it not?
Yes, I had a beautifully wrapped
she
in beautiful paper.
actually opened it yesterday because I think we both needed a little cheer after that surgery, which means we've been enjoying it all day.
Celeste Praline. Dark
It's-
chocolate, fresh lavender and vanilla natural perfume oil with a roll-on.
It's a little rollerball oil of perfume and it's so lovely. It's from my favorite Etsy seller. She goes by the name of The Little Book Eater. You close that. She makes the best little perfume oils. So this one was supposed to smell like you're walking down the street in France, and I figured it would be I mean, it's her favorite smells, but also it's kind of a promise. Someday that'll be us.
Christina in
Better
7th grade
birthdays.
chose French as her language, and that was my language that I studied in school, and we used to speak it together. And we
You
always wanted to go to France. With Lauren, we want to go to Spain. I have to learn Spanish. I have my Spanish for Dummies book, and I will do that.
I, for one, am not going to France until I'm able to eat cheese again. What a waste. But yeah, so I am going to take a rest now, I think. I'm really starting to feel the high pressure set back in, and Mom is gonna go out and enjoy her birthday. Maybe get a
Go out of
pedicure.
this hole for a little while.
Yeah, she needs to get out. She doesn't like to be cooped up.
Love you. I'm going.
Love you too, Mama. Have a nice time.
Okay.
Originally, I was planning on booking her like a massage spa experience at the Hershey spa. They do like, you could take a chocolate bath and then have like a chocolate massage and facial and all this stuff. So I thought that would be really cool. Ultimately, she decided she kind of just wanted to get her toenails done. So I think she's just gonna find a local salon, get a little pedicure, grab a little lunch, just get away for a little while. It's just what she loves to do. She loves to walk around and socialize a little, so that's good. However she wants to spend her birthday. The nurse case manager and the infectious disease team came around a little while ago to check on me since I turned so purple after the first dose of the antibiotics. So far it looks like I might stay in the hospital for the next 12-ish days. If we don't stay in the hospital, I think the plan would be for us to stay locally in a hotel just so that I'm close by. They think they might need to be doing regular lumbar punctures just to drain some of the fluid for me, which obviously you don't really want to do a lot of lumbar punctures, especially if you already have an infection, because you're risking introducing the infection to a new area and leaks. So they definitely don't want to do one yet. And hopefully we don't have to do them, but I don't know what the future looks like. So we're trying to enjoy the relaxation of being away from everyday life. And like I said, we have the best nurses, so that really helps a lot. Oh my goodness, every time I get intubated, I feel like my voice just gets a little scratchier. And who knows if it will ever go back to the way it was. Guys, I'm so excited. Okay, wait, hold on. All right, I know I look insane, but this is the most comfortable way to function when you're not allowed to get off your back. This is just what I look like now, okay? But I just got a knock on my door and my nurse came in and she said I had a special delivery. And it looks like somebody sent me sunflowers. And I'm so excited. I think they're for me. They could possibly be for my mother as it's her birthday. But I'm guessing since they're sunflowers that they're for me. And I can't wait to see them. When my mom gets back from her day out, I'm gonna have her bring them over so I can look at them more closely. From what I can see, they're just so pretty and they really just cheered me up and put a smile on my face. It's so weird filming with these glasses on. Oh my gosh. Can you guys see my eyeballs? Oh my gosh, you can. That's terrifying. I also need to clean these glasses. Lovely.
Look at this big one.
They're like perfect.
And look at all the tiny buds that are still to come.
It's so nice too, because it's like, it cheers me up, but it's also so nice for your little birthday spread we have
So
going
many
over
people
there.
love sunflowers these days.
Says get well soon, love Megan, Jack, and Molly, your fellow zebra warriors.
This is so incredible.
Thank you, Megan, Jack, and Molly.
Yeah.
I'll have to put them somewhere I can see them, or maybe I can turn on my side. Hello, you guys. It's Friday, and if you can't tell, I am actually upright today. I finally got the orders that I was allowed to sit up, which has been nice, and get up and walk, which has been even nicer. That beeping, it just means one of my infusions needs to be changed out, which seems to happen like every 5 seconds. So I've just learned to ignore it, and hopefully you guys can try to ignore it too. Today has been a very interesting day. I'm definitely starting to really experience the effects of high pressure again. I'm having a lot of cognitive issues and I'm just falling asleep constantly. I feel like I can't stay awake. My head is just killing me. My vision is terrible, but I really can't complain because I just felt so overwhelmingly loved today. We had 2 sets of unexpected visitors today. One was a lovely young woman named Amber and her sweet little daughter and her mother, who are also patients of this doctor and live locally. She came by and she was visiting all of my doctor's patients. So I got to meet her and talk with her, which was all just so sweet. And then right as they left, we hear another knock on the door. My mom's sister's husband, so my uncle, his cousins were in town for a couple days and somehow through Facebook found out that I was here. And even though I've never met them before in my life and they've never met me, they felt really called to come by and say hi and to pray with me, which was a really, really sweet gesture. They practiced a lot of prayer healing, and that's actually why they were in town. My uncle's cousin's daughter is actually going to be going to school here for something along those lines, and that's why they were in town. So that was a really interesting experience. It was kind of a different kind of prayer than I'm used to experiencing. It was a lot like some of the mindfulness techniques that I use, just slightly modified. And so that was really neat. And it was nice to meet family that I've never met and to just have company and feel at home around here, even though we're so far from home. And so despite the fact that I felt really junky today, I just couldn't help but feel supported. I also received a couple little presents from you guys, which was so nice. I got some really fuzzy orange and purple zebra socks, which is awesome. And whoever sent them didn't sign their name, so thank you so much. That was a really thoughtful gift. They sent 4 pairs, and I actually know 3 friends that are here, so I'm probably going to be sharing the love. And I also got another package from an amazing friend, Emily, who is another patient, and she is just so sweet. She sent a pair of socks too, which are so cute. You can literally never have too many socks, especially in the hospital. They look like little cupcakes. She also sent these little coloring prayer cards, and my favorite part of the gift, this gigantic, amazing pack of gel pens that I'm so excited about because I am still very much a child at heart. I love colorful gel pens. Just got a new journal. I love me some good stationery. My mom just got back to the room.
Ice, we got hot water. And
oh man, she is the best, you guys. I'm just sitting here all excited about my gel pens. Some of these are sparkly, you guys, sparkly. And definitely don't feel like you guys need to send anything. I don't even know how long we're gonna be here. But yeah, all of the outpouring of love today really, really just helped me make it through a rough day. But anyway, I should say goodnight because I just sat here for like a good 10 minutes staring at my camera, just completely unable to think about what to say next. A little bit behind in the brain department, which is kind of worrying and might be the reason that we might end up having to stay in hospital. I'm not quite sure. So, gotta go. Hello you guys, it is Sunday today and I'm struggling. I'm just finding it so difficult to do even the smallest tasks and to stay awake. I just have this overwhelming, oh, it's good if you sleep, it's resting, it's what your body needs. Can't seem to explain that it's just not like normal sleep. It feels like just fighting to stay conscious and then just kind of like hallucinating. I've been falling asleep like doing tasks and talking to people and just not my normal. Then it's just impossible to wake up. Like I can't pull myself out of it. And when I do, it doesn't feel like it was restful at all, and I can't get enough sleep to feel like I've slept enough, if that makes sense. So I've basically just been using my various art and craft projects to try to keep myself busy and to keep my mind busy so that I don't keep falling asleep. But even that isn't working. I've decided to step it up a notch and try to learn how to knit, hoping that maybe my brain will be so engaged in this new activity that it will not make me sleep, which really makes no sense at all. I know that this week has been a little bit disjointed. I honestly have no idea what I filmed. My memory's not great, so I guess it'll be a surprise to me when I plug my memory card in. But it's another week spent in the hospital, which actually went reasonably quickly. I hope that this next week can go just as quickly, because with this infection and these antibiotics, it feels like there's still so much time ahead of me. Oh, I'm sorry I'm struggling to talk. If you liked this, give it a thumbs up. If you want to see more videos, I upload every week. You can hit the subscribe button and the little bell if you want to be notified. And I'll see you guys next week. We'll see if I can manage to make anything with these. Ugh. Bye guys. I hate knitting.